Hello, and welcome back to the channel. I'm outside, really outside in the woods, and I'm enjoying it. There are a few gnats and squirrels, but I'm just loving the sounds of nature. Today, we're back at it again in your community safe space. We're going to have another discussion. I know you enjoyed the previous discussion, and today we're transitioning. So we're going to talk about traditional healing, herbal medicines. I've had some requests for it, and so today I'm going to discuss it. And that's why I came outside in nature, to make sure we could take nature outside and have a conversation about natural herbs, natural remedies, and medical care. So let's get ready. Are you ready? I'm ready. Like, comment, share, subscribe, and share the videos. Thank you. Now, today it's traditional healing and modern medicine. Now, if you hear me going, ouch, ouch, there are bugs out here and they are biting. But this topic is important and we're going to have the discussion. I like nature and I've got my bug repellent on, but somehow nature loves me more than I love it today. So let's get it started. Are we ready? Yes, we are. So let's go. There are people all over the world who still believe that leaf before the lab. And you could understand that. The tea before the tablet, the root before the prescription. And for many families, this is not ignorance. That is history, that is culture, that is memory, that is survival. That is what grandma trusted. What mother prepared, what families leaned on long before hospitals, pharmacies, insurance cards, and specialists ever entered the picture or the conversation. So let's say this clearly from the very beginning. These bugs are biting. Let's say this clearly from the very beginning. Traditional healing deserves respect. And we know that. Because we wouldn't be here if someone traditionally did not use medicine to protect themselves, to grow the family. And we've evolved, and so we're having this conversation. So, traditional healing deserves respect. But here is the truth many people are not ready to hear. What helped your family at 25 can become dangerous at 55. Not because your tradition failed you, not because everything natural is bad, and not because modern medicine suddenly became perfect, but because the body changes. The body changes with age, the body changes with blood pressure, the body changes with diabetes, the body changes with kidney disease, liver disease, heart disease, surgery, medication, inflammation, and of course, time. Who can leave out Father Time? And that means the same herbal remedy you have always taken may not behave in the same way inside the body you have now. That is where this conversation becomes bigger than preference. This becomes a public health conversation, because if you are using herbs, bitters, teas, powders, roots, oils, or traditional remedies, and your doctor has no idea what is in your system, that is not just personal choice anymore. That, my friend, can be a risk. And some of the most dangerous medicine in the world is the medicine nobody knew you were taking. Have you ever heard the saying, the difference between medicine and poison is the dose? We're getting there. That's what we're trying to make sure you understand. It's not just something grandma says and it's funny. It's actually practical and factual. This is not a video to tear down herbal medicine. Of course not. I don't do those kind of videos. I don't tear anything or anyone down. I explain and I advocate. I inform and I allow you to grow your perspective. And this is not a video to blindly worship modern medicine either. No, this is not that video. This is a warning and an invitation, because traditional healing and modern medicine should not be enemies. They should be working together to keep you alive, right? Of course. To understand this issue honestly, we have to start with something many people in healthcare still do not understand. A lot of people do not reject modern medicine because they are uneducated. They reject it because they do not trust it. Of course, it's simple. They do not trust it. And for some people, that distrust cannot come from nowhere. Some people have been dismissed in exam rooms. Some have been rushed through appointments. Some have been over-medicated. Some have been ignored. Some have even walked into healthcare systems feeling like they were being managed, not heard. And I'm sure each of you could relate to one of these. So when people feel unseen, they often return to what feels familiar, what feels human, what feels ancestral, and what feels safe, what feels like home. And that matters because public health cannot be honest if it only studies disease and ignores trust. Trust is a health issue too. Trust is important in maintaining compliance for providers to know that once a patient is treated, that they'll follow their treatment plan. And even global health leaders have acknowledged that traditional, complementary, and interactive medicine, as well as integrative medicine, is used widely around the world, not as a fringe idea, but as a real part of how many communities understand healing. The World Health Organization says traditional, complementary, and integrative medicine is used in 170 countries. Yes, 170. And its current strategy emphasizes evidence-based, culturally respectful, integrative, as it integrates into the health system rather than erasing traditional practice altogether, which would almost be impossible to do. That is important because the best public health response is not to mock tradition. It is to ask, what are people thinking? Why are they taking it? What are they hoping it will do? And what happens when those remedies meet aging, chronic disease, and prescription medication? This is where this becomes life and death. Now let's talk about one of the most dangerous health myths on earth. And that is, if it's natural, it must be safe. No. Do not take that approach. That is not how the human body works. Something being natural does not make it harmless. It makes it biologically active. And if something is biologically active enough to help the body, it may also be powerful enough to stress the body, interact with the body, or harm the body under the wrong conditions. That means herbal products can potentially affect blood pressure, blood sugar, bleeding, clotting, sleep, liver enzymes, kidney function, heart rhythm, anesthesia, and how other medications work. That is not fair. That is physiology. The U.S. Food and Drug Administration warns that many dietary supplements and herbal products can have strong biological effects, may interact with medications, may interfere with lab tests, and may even have dangerous effects during surgery. The FDA also makes something else very clear. These products are not approved for safety and effectiveness before they are sold in the same way prescription drugs are sold. And that right there is where many people are getting caught, because people often assume if I bought it in a store, if I ordered it online, if everybody in my community uses it, if it came from a plant, then surely somebody tested it. But I'm here to tell you, not always. And that means two products that claim to be the same herb may not truly be the same at all. One may be concentrated, one may be poorly manufactured, one may contain a little bit extra, one may be contaminated, one may hit your body far harder than you realize. So the real question is not, is it natural? The real question is, what does this do inside my body at my age, with my diagnosis, with my medications, and with my organ function? That is the question adults ask when they are serious about staying alive. And that's the question I want you to ask, because you are serious about staying alive, or you wouldn't be here watching and listening. This is where many people make a dangerous mistake. They say, I've taken this all my life, and maybe you have. Of course, maybe you have. But your body has not been the same all your life, and that changes everything. Your liver changes. The liver helps process your many medications, compounds, and plant-based substances. If that system gets stressed, inflamed, or injured, things can build up in the body or create toxicity. The National Institute of Diabetes and Digestive and Kidney Disease has documented that herbal and dietary supplements can sometimes contribute to liver injury. Yes, liver injury. And in rare but serious cases, that injury can be severe enough to lead to liver failure or transplantation. Yes. Now, let's talk about your kidneys. They change. Your kidneys help filter waste, regulate fluid, and maintain internal balance. As kidney function changes with age or chronic illness, substances may stay in the body longer or behave differently than they once did. Your medication list gets longer. This is one of the biggest aging realities no one talks about enough. At 25, maybe you were taking nothing. At 45, maybe now it is blood pressure medication, diabetes meds, cholesterol meds, thyroid medication, anxiety meds, pain medication. At 60 or 70, because we're moving up the scale, right? 25, 45, now we're at 60 or 70. Maybe it is even more than what I just listed. Now, imagine adding multiple herbs, tonic, detoxes, immune boosters, capsules, teas, and traditional remedies on top of all of that, with nobody reviewing the full picture. This is how people quietly get into trouble. Your chronic diseases change your tolerance. If you have hypertension, diabetes, kidney disease, liver, heart disease, clotting disorders, autoimmune conditions, you are no longer working with the same baseline body you had years ago. You are working with a body that may now be more vulnerable to changes in pressure, sugar, fluid, bleeding, metabolism, and especially organ stress. And this is exactly why what used to work just fine may not be fine anymore. That is not disrespecting herbal medicine. That is respecting biology, your body. Here is the part many people miss. Herbal medicine does not always cause harm in obvious ways. Sometimes the danger is quiet. Sometimes it looks like unexplained dizziness, strange fatigue, worsening blood pressure, unstable blood sugar, unusual bruising, stomach upset, rapid heartbeat, abnormal lab results, or delayed healing. And because the person thinks it's only herbs, they never connect the symptoms to what they are taking. That is where the risk hides. That is where the risk is living. And this is what I want you to go and deal with. It's like emptying your closet, going through and taking out the old stuff. We want to get rid of the old way of thinking so we could advocate better. So let's take a look. 1, herb-drug interactions. This is one of the biggest public health concerns. Some herbs can make medications stronger. Some can make them weaker. Some can increase side effects. Some can increase bleeding. Some can change how drugs are absorbed, broken down, or eliminated. The National Center of Complementary and Integrative Health specifically advises people to check for herb-drug interactions and notes that many herbs can affect how medicines work. It's herbs at a glance. Resources are built around this exact concern. Now, let's take a look at dose confusion, because that's another issue. A homemade tea is not the same as a concentrated capsule. A household preparation is not always the same as a commercial extract. People think they are taking just a little or some of something, when in reality, they may be taking a highly concentrated substance with much stronger effects. Now, continuing, let's talk about product quality problems. Not every product is pure. Not every bottle is honest. Not every label tells the whole truth. And when people buy random imported, unlabeled, or internet sold products, the body becomes the testing ground, people. Your body has become a lab. Let's continue. Let's look at delayed diagnosis. Now, we've got all these ahead of us. Your body is now becoming this lab. Let's put into this mix delayed diagnosis. And this one is hard, but it has to be said. Sometimes people stay on herbs alone too long while a serious disease quietly gets worse. And there are some illnesses where delay is not neutral. There are moments when supportive care may help. And then there are moments when the body is no longer asking for support. It is demanding intervention. And if people miss that moment because they are trying to tough it out naturally, the consequences can be devastating. This is not anti-herbal medicine. This is anti-preventable harm. Now, this is a section I need you, the audience, to really sit with me. I want you to sit with me and understand this. Because once chronic disease enters the room, this is no longer a casual conversation. For those with chronic disease, this is not a casual conversation. You need to be taking notes and listening keenly. If you have high blood pressure, anything that can affect circulation, vascular tone, fluid, or heart rate deserves caution. Because natural does not mean it is neutral to your cardiovascular system. If you have diabetes, pay attention. Anything that affects metabolism, appetite, insulin sensitivity, or blood sugar handling matters. Because if you are taking medication and adding herbs or supplements on top of that without oversight, you may not know what is dropping your sugar until it drops way too low. If you are on blood thinners, for my people with blood thinners, this is a red flag. Stop, 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 stop. Anything that affects clotting or bleeding becomes serious. That can matter before surgery, after an injury, during dental work, or while taking other medications. For my people with kidney disease, you cannot casually add products to a body that already has reduced filtering capacity. Because remember, we said the kidney does the filtering. Now, for my people with liver disease, step to the front. You cannot assume your body can safely process every concentrated herbal product. For those with heart disease, this is your time. Anything affecting rhythm, blood pressure, fluid, or vascular response deserves caution. If you are older and taking multiple medications, this is one of the biggest patient safety issues in modern public health. Because the more things you add, the harder it becomes to know what is helping, what is hurting, what is colliding, and what your body can no longer tolerate. And this is where the conversation needs to mature. Because the real question is not herbs or medicine. The real question is, how do we protect the patient? Now, we're outside. You're going to hear sounds, birds, children, dogs. We might even hear a cat. We also hear cars and bikes. It's warm, people, and people are coming outside. Now, let's continue. The real question is, how do we protect the patient? That is the only question that matters. Not ego, not internet debates, not ideology, not pride, but protection. Because if healing is real, then safety has to be part of that conversation. Now, we need to talk about one of the most common and dangerous mistakes of all. People do not tell their doctors what they are taking. We said that earlier. We need to be honest with our providers. And I can understand why sometimes it's out of shame. Some people are afraid they will be laughed at. Some are afraid they will be dismissed. Some think the doctor will immediately tell them to stop everything. Some believe that the herbs do not count as something the doctor would be interested in. But because they are not prescriptions, but they do count. I want you to listen carefully if you are included in that list of people who are not sharing everything with your doctor. If your healthcare team does not know what is in your body, they cannot safely care for you. They need to know about, and I'm going to list what they need to know about, please. Teas, roots, tinctures, powders, bitters, oils, supplements, imported products, detoxes, cleanses, boosters, and every natural thing you are taking regularly. Bombard the doctor with information. He can eliminate what he doesn't need, but what he does really need, he or she, is honesty. Because all of it matters. It matters before surgery, before new medication. It matters when your labs come back abnormal, when your pressure is unstable, when your sugar drops. It matters when your kidneys are struggling. It matters when your liver is inflamed. And this is not about betraying your culture. It is about protecting your body. Because the safest patient is not always the one who makes the fewest things or who takes the fewest things. Sometimes the safest patient is simply the patient whose care team knows the full story. That can save lives. Literally, that can save lives. And because this conversation has to be honest, let's also say this. Modern medicine gets things wrong too. Sometimes people are overprescribed. Side effects are minimized. Patients are not listened to. Sometimes healthcare becomes fragmented, rushed, or transactional. Sometimes medicine forgets the human being and only sees the chart. That is true. And when that happens, people pull away. So if modern medicine wants trust, it has to become more trustworthy. That means healthcare professionals need to ask better questions. What are you taking at home? What healing traditions matter in your family? What herbs or remedies do you use regularly? What are you trying to avoid? What are you afraid of? What do you believe is helping you? Because if healthcare does not make room for the truth, Patients will keep hiding the truth. And hidden medicine is dangerous medicine. That is the public health lesson. So what is the better way forward? Not shame, not mockery, not superiority, not pretending one side knows everything. The better way is integration with accountability. Let me repeat it. Integration with accountability. That means respecting tradition. We do not dismiss traditional healing just because it did not come from a pharmacy. We respect science. We do not dismiss physiology just because a remedy is old. Respect the aging body. Your body is not static. It changes. We're going to also respect chronic disease. Once disease enters the body, the margin for error gets smaller. Respect transparency. That's so important. If you are taking it, please say you're taking it. Respect timing. There are moments for supportive care and there are moments for urgent care. Wisdom is knowing the difference, and honestly, that is where the whole conversation needs to grow, because the internet loves childish extremes. They love to say doctors are evil, herbs are fake, natural cures everything, prescription medicine cures everything. No, the real life is more complicated than slogans. Real life is way more complicated than slogans. People deserve better than slogans. They deserve truth, nuance, safety, respect, and care that sees the whole person. And that is what public health should be doing at its best. Here comes the high scream, man. Not forcing people to abandon tradition, but helping them survive long enough to use tradition safely. So, if you use herbal medicine, hear me clearly. This is not me telling you to throw away everything your family taught you. This is me telling you, protect yourself, because your body is changing, because age changes the body, because chronic disease changes the body, because medications change the body, and because silence can cost people more than they realize. Your herbs may matter, your traditions may matter, your beliefs may matter, but your kidneys matter too, your liver matters too, your blood pressure, your blood sugar matters as well, your heart matters too, and your life matters too. So write it down. Everything, every tea, every capsule, every powder, every root, every oil, every tonic, every natural product. And tell your doctor, tell your pharmacist, tell your healthcare team, not because you are betraying your culture, but because real healing should never have to hide. And if public health means anything at all, maybe it means this. The goal is not to force people to choose between traditional healing and modern medicine. The goal is to help them live long enough to benefit from both. If this message matters, please share it. I want you to comment. Let's talk about it, because sometimes the most dangerous medicine in the room is the one nobody knew you were taking. That is true. Now, as always, don't you feel your perspective has increased? Your ability to advocate for yourself and your family or your community has increased? Like everything else, we are changing, we are growing, we are learning. It's a wonderful day, and we are smarter and wiser. Thank you so much for being here. Remember, like, comment, share, and subscribe, and I will see you in the next one. Have a wonderful rest of your day.